Hey, welcome back to Paws and Pointers. I'm your RVT host, Sam. This video is going to show you my technique for extracting the canine tooth in a pit bull. My plan was to talk through this video as I was extracting, but if you've ever heard the sound of the drill or the conversations that happen in the treatment area, you'd say I should probably continue with the voiceovers. I'll have to make another video of the doctor cutting the flap and show you how I lift the gingiva from the bone, but that sounds like next week's problem. Notice the difference between the bone and the tooth. The bone is a little spongy and has a blood tinge to it. The tooth is more of an off-white ivory color and is very hard. For this part, I'll use a 701 burr and drill around the tooth. This burr is usually used for splitting the 2 and 3 rooted teeth, but I find that it works well for the whole extraction process. You want to gently drill the spongy bone down to the tooth on the lateral, distal, and mesial surfaces, creating sort of a moat around the tooth. To create a smoother surface, I'll switch to a diamond burr to kind of clean things up. Next, I'll use a 4 or 5 millimeter elevator and start breaking down the periodontal ligament. You can use the surrounding bone to gain leverage and avoid damaging any other teeth. Once the tooth is removed, make sure the root is intact. The main problem with this extraction would be an oronasal fistula. It's where the bone holding in the tooth has eroded into the nasal cavity and creates a passage between the two. It can cause a heavy nosebleed. Gently lift away the gingiva from the hard palate to create a place for your suture. Make sure there's absolutely no tension and the pieces of gingiva meet perfectly together. This will prevent any dehiscence, which is especially important if there happens to be an oronasal fistula. For a big dog like this, my suture of choice would be 4/0 monocryl on a taper needle. I'll start with the mesial aspect of the flap and suture the corners together using a simple interrupted pattern. I'll tack down the middle of the flap next. The first throw is a surgeon's knot, while the second and the third are single knots. I only do 3 throws to decrease the irritation to the patient. If they lick or rub at the sutures, they will come out. For single extraction sites, I'll use the simple interrupted pattern for the entire closure. For multiple extractions in the same arcade, I'll use a continuous pattern. And I'll show you that technique in another video. You'll see an occasional cruciate pattern as well, and those are totally acceptable. make sure no blood is leaking through, which will likely look like bubbles oozing from the suture site, and that's how you know you're done. Thanks for coming back to Paws and Pointers. Don't forget to like, subscribe, and turn on notifications. Stay ready for the next video.